Okay, so on the complete urinalysis, again, you want to make sure that you are looking at what we're actually checking. This is going to be your results and the ranges and or what it should be if it's normal. Okay, so on your urinalysis, so first thing we start with is color. Now, why is that important? The typical person's urine should be a slightly clear to yellow color. That is normal. Okay, and if you look over here, normal, they have even down here as yellow. Okay, what we're looking for in here is that it's not red, it's not brown, it's not a yellowish brown color, because that will then tell us that we have gallbladder, liver, kidney problems and or numerous other situations that could be occurring. So we always want to have a complete urinalysis color of a white or a white yellowish color. Okay, clarity, same thing. We want to make sure that it's clear. We want to make sure that it is not cloudy, because this will determine that we are releasing too many proteins or sugars or things into our urine. Okay, specific gravity, pH, protein, glucose, etc. All right, so specific gravity, this is just a measurement of what the gravity should be. So essentially they are weighing the gravity, and you should be between a range on this particular lab of this, and so we are falling right in the smack dab middle of that, so that is good. Now pH, a little bit more important. pH is something that is very, very important, not just for what your urine is, but for your blood and for your overall body. The normal pH is, for a urinalysis, is 4.5 to 7.5. Now I will tell you, in my 20 years of being a physician, and my personal opinion on this, I like to see people's pH right about 7 or maybe even a little bit better. This is only achieved by getting a 7 or a neutral reading or above, slightly above this, by diet and exercise. If you are eating poorly and or not exercising, you are going to be below 7. Now, why is that important? Because if you are below 7 on your pH, you are going to be what's considered acidic. And the more acidic your pH is, the more acidic your body is. And this is why people get infections, cancer, and other problems going on. Okay? So always maintain a healthy diet, exercise, drink lots of fluids, alkaline water, and good vitamin supplementation to achieve a higher pH. Because your body, whether it's within your gut or your urine, will always try to regulate what it should be, and that's called homeostasis. But again, neutral, right about 7, and this particular patient is smack dab right on the number, or even a little bit higher is where I like to see this. Now coming down here, protein, glucose, ketones, urine, bilirubin. These are numbers that are either positive or negative. And this particular patient is all negative, and that means there is none found. And this is what the range says, should be negative, and we have none of this being released into the urine, which is great. Okay. And again, why is this important? If we have proteins being released into the urine, this is certain and very chronic diseases, some acute diseases, and or your body is not breaking down proteins or breaking down proteins too quickly from your liver and your kidneys. Glucose. If glucose or sugar is being released into your urine, it is a very high sign of diabetes. And this is something that we are looking, again, remember I told you, we're going to be comparing your CBC, your chem panel, and then we're going to be comparing both of them. And if we do a urinalysis, we can compare things that are here, here, and here to determine what is going on. So if you look back up here for just one quick second, your comprehensive metabolic panel of your glucose level, we want to make sure that was reading normal. If we come down here and look at your glucose level in the urinalysis, it was negative. So we have a normal level in both areas. If you have a higher number here or a higher number in the urinalysis, you are at direct risk or already have diabetes. And something that you need to get into us ASAP, because there are things we can put you on to either reverse it if it's in initial stages and or control it for lifetime. Ketones, urine bilirubin, like we just talked about. Urobilinogen, same thing. This has a specific number, range that you should be within, okay? And again, these are proteins, bilirubins, things that are being broken down from your liver, gallbladder, and or kidneys, okay? Nitrites found in the blood should be negative. Any blood that's being found in the urine. Very, very important, guys. If you have trace amounts of blood, this can occur with males or females, infrequently, no, but it does occur, where it means nothing. But if you have even trace amounts in the blood, you need to make sure you're getting follow-up urinalysis as well as complete blood workup. Because when you have blood in the urine, this is a direct sign of bladder cancer, possibly kidney cancer, and other types of cancer, okay? It could just mean you had some other situation going on, but again, very, very important to look for, all right? Last thing here on the complete urinalysis is leukocytes. Leukocytes are a type of white blood cell, just like we covered, or similar to what we covered in the CBC Chem panel. Leukocytes are a type of white blood cell that if it's being released into your urine, it tells me that you have some type of infection, probably bacterial infection, and your body is trying to fight that infection, and it's probably going to be in and around your urethra or your bladder or your kidneys, and that's why you are releasing leukocytes into your urinalysis, okay? So what I wanted to do with this is just finish up with both the CBC Chem panel and then the urinalysis. And now what I want to do is I want to switch over to the same patient that I just covered and blood work that I did approximately 2 months later, and I want to show you some of the differences of things I found on this patient. So let me grab this sheet. Okay, so this is the second part of the labs. And so this lab, if you look down here, this is again CBC Chem panel, or essentially the Chem panel of what we did on March 23rd, 2020. All right, so this is about 2 months after the labs that we just reviewed. And I'm not going to go through every single number or lab value here because we just went through that. But what I do want to point out is on that first lab, and this is the take-home message that I'm trying to give to you guys, is that don't just look at your result and what it is, but look at what the reference range is. Because if you're anywhere close to the border of the low or the high side, flag it. Mark an arrow next to it so that you at home are watching what it is now and what it is next time you get your blood work or your urinalysis done. And if you remember back on that first set of labs, I marked an arrow next to albumin, which is a type of protein. She was a little bit low on that, and right now she's still reading low on that. Now again, her situation is a little bit different than average because she is pregnant. And so the baby is obviously drawing more proteins from her. Her body is working overtime. So some of her numbers that are just slightly off, and again, we're talking 0.2 of a point. So not a big deal. But again, things that this is my patient, and I need to be adequately watching what is going on with this particular person. Because if I just said, well, you're 0.2 of a point, no big deal, and this particular person has a problem, or I'm not telling this person to eat more proteins or watch their sugar levels or diet-related stuff, exercise-related stuff as she's pregnant, not only can she have a problem, but the baby can have a problem. If you look down here for a second, we talked about ALT and AST numbers. And so this is something that, again, I wrote down on there, watch these on the last labs. And again, we are seeing a slightly high number here at 35. We're only 3 points higher than this, but we're staying within range of this liver enzyme, all right? Let's look at this, calcium. Now, this particular person, since being pregnant, only being pregnant, because I have labs that go back 10 years on this particular patient, calcium levels, she has a chronic history of low calcium levels since being pregnant. So I have supplemented her with certain vitamins, certain physician-grade vitamins that not just give her calcium, but give her vitamins, minerals, and amino acids to assist her while she's pregnant and while she's breastfeeding after she delivers. Some of the creatine levels that we pointed out on the last labs hovering right at the lower level of normal here. Okay, she's just a little bit lower than what the normal ranges is. But the last thing and most important thing I wanted to point out was, do you remember how I talked about on both of her CBC and chem panel, her sugar level was normal? And I pointed out that in her urinalysis, there was no sugar being spilled. Now, literally just under 2 months from the last lab, we ran her blood sugar levels. But on this, we gave her a sugar drink to test her for gestational diabetes. And I was able to find gestational diabetes with her. So the normal range, like we covered here, if you're fasting, is 65 to 99. Her blood sugar level was at 184. And this is after we gave her that sugar cocktail drink, whatever you want to call it. There's no real name for it. But what this means is that I have then put her on a diet plan and a diet diary to be checking her blood sugars 4 times a day, once fasting and 3 times after she eats, every 2 hours after she eats, breakfast, lunch, and dinner, to be making sure that she doesn't end up with diabetes after she delivers a baby, and to make sure that the baby is delivered without getting diabetes as well. Okay? So again, wrapping this up, if you have numbers that are a little bit low or high on your blood level, make sure you are drawing marks next to them so that either you are paying attention to them and or you are pointing them back out to your doctor and asking, what does this mean? What does that mean? Go over these things with your physician so that they are aware of you are paying attention to your blood work. Because if you are paying attention to your blood work, then that means your doctor is going to pay more attention to your blood work. All right, so that concludes the CBC, chem panel, urinalysis, and descriptions of the blood work. I hope that was informational. A little bit long, I understand, but it's really, really important, guys, for you guys to understand what the result is, what the reference range is, and remember, look at the stuff. That's not just high or low, but if you're anywhere close to the borders, make sure that you're paying attention to it and point it out to your doctors. Again, hope that was helpful to you guys. I'm Dr. Joe Brown. Your health is in your hands.